Station that works for you. Good Morning Maryland at 9.
Megan always loves when I give examples like this. So, Megan at home, let's say you're 85 and you're going in tomorrow for a hip replacement. To calm you down and prepare you for what's to come, here's Dr. Alicia Arbaje from Johns Hopkins School of Medicine. There is a lot of calming down. A lot of, people up there in age are going in for elective surgeries now, and they're scrambling at the last second to make sure everything goes right, right?
Right, and this is the one time when you can actually plan in advance as much as you can, and the more preparation you have, the better it can be. So I think there's a few things that people often just don't think about, and it's good for us to kind of go through them.
And you say, spread the news.
Yeah, so it's really important. Just like when you have any other big news, you want to tell a lot of different people. In this case, you want to make sure you tell your primary care doctor. They're usually aware, but in case they're not, it's important for them to know. And then any other primary care or specialty provider that takes care of you.
And you said prepare an updated condition and also the medication list. And carry several copies with you.
Yeah, here's where you don't want to worry about making too many copies of something. Bring a whole stack of a list of what you take for your medications and what your conditions are, and give them out to everyone that comes by. If they don't want it, they'll tell you, but it's important for everyone to be on the same page.
And of course, you want to bring somebody with you or a tape recorder.
People feel a little bit weird about doing that, but it's very important to take notes or have someone with you. This is not the time to kind of do it all yourself and be by yourself. You really want someone else because the anesthesia can change the way you think about things. It's important to have someone around.
I love this question. What is the actual surgery you are recommending? You would be surprised.
That's right.
When you talk to, well, what are you having done? They're doing something with the,
I'm not the doctor. I don't know.
It's amazing.
It is amazing. Or my daughter will take care of it. They'll know.
Right.
And that's all okay, but someone should know what's going on. And I would, get a picture, get a drawing so that you can better understand what's being done to you, because you may need to explain that to other healthcare providers later.
And will I go home after surgery, or maybe I have to go to rehab? What do I have to do?
Right, that's a very important question, especially for orthopedic type procedures. It's really important to prepare yourself for in case you need to go to rehab afterwards. And often that's a very normal thing that happens after surgery, but older adults may not be prepared to be away from home for that amount of time.
And when I get home, do I have to change my home?
Exactly. Right, because the recovery can take weeks, months, depending on the kind of surgery you're having. So maybe you're not going to be able to lift 5 pounds when you get home. So does that mean you need to change where you put things on the shelf, where you move the rugs and the chairs so that you don't have to lift when you vacuum, that kind of thing. So it's important to think.
And you also want people to have a list of a month out of it, a month later after the surgery, like payment of bills. How do I do that?
Yeah, I can't tell you how many patients I've had in the hospital who have had to stay a little bit longer than they had planned and are so worried about getting home to write that check to their insurance company or to make sure they're taking care of something they haven't taken care of. So try to plan in advance. Talk to your doctor to know what period of time would be reasonable. Usually a month is at least the minimum, but I would make sure they've thought at least that far in advance.
And even you got to think about groceries and meals, right?
Right, exactly. I mean, again, these aren't things you often think about, but stock your fridge, make sure the freezer has enough stuff to get you by. It's almost like if you're preparing for a big storm. You want to just have everything ready.
And also bring essentials to the hospital.
So this is actually really key. People don't think about bringing their dentures, their hearing aids, their eyeglasses, because they think, I'll just be there a couple days. But one of the biggest complications after surgery is getting confused temporarily, and having those items with you can help you not be as confused after surgery.
And again, review your long-term affairs, right?
Right, so we talked about the short-term affairs just now, but long-term, this is a great time to think about who can make decisions for me if I'm not able to, and that sort of thing. So this is a great time to review that.
See? I'm all ready for my hip
replacement
tomorrow. Yes.
Excellent.
Dr. Arbaje from the Hopkins School of Medicine. All right, next up, it's the first